Good morning and welcome to Respite, presented by the Ohio Caregiver Support Network. I'm Laura Ackerman, Disability Services Coordinator for Ohio Agribility and OSU Extension. Handouts and resources for this webinar are available at agrability.osu.edu/caregiver-support-network. That's spelled agrability.osu.edu/caregiver-support-network. Once you're on the Caregiver Support Network page, look for the link for caregiver videos and handouts. On that page, you're looking for the Caregiver Respite Action Plan handouts, which we will be talking about today with Dr. Teresa Young. She's a licensed psychologist and a caregiving expert. Dr. Young, thank you so much for joining us today. Thank you.
You're welcome. Well, hi, everyone. I am Dr. Teresa Young. Thank you all so much for setting aside some time today to talk about respite, both here at our 10 a.m. webinar and then again at 2 p.m. with our panelist discussion. So Laura, if you want to advance the next slide, I'll talk a little bit about myself, but I'll make this part brief. So I am a psychologist here in private practice in Columbus, Ohio, but I do have some experience working in rural health settings. So hopefully some of the things I talk about today, folks in more rural settings will be able to connect with as well. My specialty areas are in adjustment to aging, chronic illness, acquired disability, and caregiver support. I've had lots of experience over the course of my 10 years here in the mental health field. I've worked at the VA in long-term care, a few years in physical medicine and rehab, college counseling centers, and in community mental health. My passion is really around those areas that I specialize in, though, and so that's why in beginning private practice, I decided to focus on aging, caregiving, and acquired disability. So if you want to go to the next slide. So here I have a pretty lengthy list of signs of burnout, and this is actually from my presentation last year, but I figured it might be a really good place to start in talking with our caregivers. So I'll read through these for you. It's pretty lengthy. So here are some very common signs of burnout. Feeling exhausted, not wanting to get out of bed, feeling irritated by little things, snapping at people, spending less time with friends, feeling down or more anxious, getting sick more often, feeling resentful toward other family members, unhealthy coping behaviors like drinking or going to bed late, scrolling through your phone, not exercising, difficulty making decisions, loss of privacy, feeling torn between responsibilities, feeling alone or isolated, aches, pains, headaches, digestive disruption, thoughts of wanting to hurt yourself or your care recipient. You know, maybe things get too intense and you've been arguing quite a bit, or someone has told you that you seemed burnt out. So that's a pretty lengthy list. I'd love for our audience members to share with us if you've experienced at least 3 of those signs of burnout at any given time. So how many of our audience members here today have experienced caregiver burnout?
Teresa, right now we have 57 people that say yes and 6 that say no. I'm going to give it maybe another 15 seconds or so to for people to, and I think I can share it once I end it.
Good deal.
61 yeses and 6 nos. So 91% of people say yes.
Yeah, that certainly sounds like the majority of us have experienced some burnout and perhaps even, oh, that's great. Yeah, I can see that now.
Good.
So for those 6 lucky souls, it sounds like maybe you've experienced maybe 1 or 2 of these at a certain period of times or none at all, which lucky you. But it sounds like the majority of us have felt pretty burnt out at certain periods of time during this caregiver journey. And the reason I wanted to start there is because I think understanding and acknowledging the signs of burnout are kind of the first step in recognizing that maybe it's time to seek some respite. So let's talk a little bit more about that. The next slide. So what is respite? When we use this term, it's kind of a formal term in the caregiving world, but it might be sort of an unknown for some of you. So respite is really just a break between the caregiver and the care recipient. So that can be a formal break that happens through an agency or a facility, or it can be informal, where a family member takes over for a period of time so that you as the caregiver can get a break. And the amount and length of time needed for respite care really depends on individual needs. So it really does look different depending on the caregiving situation. Next slide. Now, the decision to seek respite comes from a lot of different places. Sometimes you will hear that nagging voice from your own mind that's saying, gosh, I could really use a break. Or if I could just have a few hours to catch up on some things of my own, that would be really helpful. Or maybe you have just been on autopilot for quite some time, and a friend or a family member has said, you know, if you ever want me to come over and watch so-and-so or spend time with so-and-so for a little while you go take a nap or do some self-care activities, I would do it for you. Or maybe you've even been to a doctor's office and a provider has inquired to you about getting some respite services. Sometimes, you know, because they don't see you as often, they can detect your frustration and burnout before you can. And so they might preemptively say something to you. Next slide. So as I was putting this together, I was thinking, who actually gets respite? And I came across this poll from the AARP and the National Alliance of Caregiving. And actually only 38% of people say that respite would be helpful, but only 14% of people actually obtain respite. I would imagine that would be pretty surprising to a large number of us. So I thought that was interesting. And I run into this in my own personal work with caregivers. As much as they believe it's helpful to them, it's very difficult. There are a lot of barriers to seeking that assistance. And Laura, I think the slides advanced a little bit. So is that the next one? Cool. Okay. So let's talk about what gets in the way. Now, most of these are psychological barriers, but I also want to give a nod to financial barriers as well, other practical limitations like transportation or not having anyone nearby. But these are the ones that when the rubber hits the road and we've been told that we need to find some respite services, these are some of the very common barriers that people run into internally that keep them from actually initiating respite service. So the first one that I always run into is intense feelings of guilt. The caregiver feels like they can't just dump someone somewhere, or they don't want to give the impression from their loved one that they think that the loved one is a burden to them. Other times there might be discomfort with asking for help. And a lot of times that manifests as someone saying, well, everyone's just so busy with their own lives. And so the careful observer will hear that as I'm uncomfortable asking other people for help and telling them that I need that help. Some folks might feel overwhelmed, you know, and I think we'll hear a lot about that during our panel discussion this afternoon and how different the pathways are to seeking respite. And there are so many agencies and ideas that sometimes people say, I just have no idea where to begin. So I just kind of keep going with how things are right now. And then another one is poorly defined goals. So there's not a clear definition of what the person's actually looking for. And so the more vague those goals are, the more difficult it is to seek help because you're not really sure what exactly you're looking for. So that might come about through saying to yourself, I'll get some help one of these days. And I'm going to pause because I saw we had someone in the Q&A. Oh, yeah, you're welcome. And how do you get respite in the pandemic, especially when the caregiver lives with the person needing care? That has been a real challenge for folks. It really just kind of depends. I, here in Ohio, am part of a senior services roundtable. And when I've run into that issue, I've put it out to the listserv and have found people who are willing to come in and spend time with the person. Of course, that is a calculated risk during the pandemic. And that might even, Camille, be a good question to pose during our breakout session, because there's probably some other folks who have sought respite during the pandemic and could offer their feedback to you. So let me go ahead and cover part 2 here. And there is a poll coming up about whether or not you have thought about at least one of these barriers to respite. So 3 more would be goals depending on another person changing. I do often hear, especially when multiple caregivers are involved, someone might say, well, once my sister comes to her senses, she'll help me out more, or once they realize just how difficult this is. So we're waiting to seek respite depending on the enlightenment of someone else. You already recognize that you need that help, but you're waiting for somebody else to recognize it for you. Another general tendency to overcommit. So that person might just say, I just have so much going on already. I can't imagine adding another thing. So taking the time to invest in seeking respite services feels like more of a chore because that person is already kind of spread too thin. And then the last one is a comparison to others. So I've got an example here of my friend Bonnie took care of her husband for 3 years before he passed away. So I should be able to handle all of this myself. So a lot of times we'll have folks who will compare themselves to other people. They know other caregiving stories, and they might be neglecting other pieces of that story, but using it to prevent themselves from actually seeking respite assistance. So if you haven't had a chance yet, go ahead and fill in that poll on barriers to respite.
So far, we have 53 people that say yes and 7 that have said no. So 89% have said or thought at least one of the barriers.
Okay, so it sounds like that is something that has been, at least one of these has been top of mind for some of you, and we will talk about that more during our breakout session. Some ways to challenge that on the next slide involve a little bit of kind of light cognitive behavioral therapy. So these are some questions that you can ask to yourself to sort of help you get around some of these barriers. So one question might be, what would an alternative way to look at this issue might be? For those who are often afraid of asking other people for help, I would say, hey, think about the times when someone has asked you for help and how good that made you feel. When you ask other people for help, you're giving them a chance to feel good about themselves. So that's sort of another way to reframe that particular barrier. We might also say, what evidence do you have that X, Y, and Z? So for that last one about someone doing an excellent job of taking care of their loved one, well, what evidence do you have that they didn't struggle? Were you there at 3 o'clock in the morning when so-and-so got up and needed to use the restroom? Do you know about what that was like day in and day out? Another thing we might do is explain why it's necessary or beneficial to stay the same versus to make changes. So what would happen if nothing changes? If things just continue on this way, how do you see that evolving and unraveling potentially? How might things be better for you if you have a little bit more respite? Do you think you would spend more quality time with your loved one because you're not feeling resentful anymore? And then how might you advise a friend in your position? This is always a very helpful tactic, especially for folks who tend to be their own worst critic. So once you say, well, how would you approach a friend? Then folks will often say, oh, I would never be as cruel to them as I am to myself, right? I would never put this kind of pressure on a friend the way I do to myself. All right, next slide. So this will be on your respite action plan, which I think Laura has sent out to everybody already. Yeah. But just for a refresher, and this will come up during our breakout session, we want to try to create a respite plan that has a SMART goal to it. And SMART goals are ones that are specific, that can be measured, that can be achieved, that are realistic and timely. So a non-SMART goal would be something really vague, such as, I want to get more respite. But a SMART goal looks much more specific because we know that people are more likely to actually follow through on their goals if we remove barriers and make the goals specific. So this example of a SMART goal is starting next week and extending into the future. I would like to find an agency who can send someone to spend time with my loved one over a 4-hour period each week. So here you've got the specifics. You can measure that out if they come every single week and for that period of time. That feels pretty achievable. It's not too expensive. It's not too time consuming. It's realistic and it's timely. So we're going to start it next week. We're not putting it off for a month or two down the road. All right, next slide. So just to give you an overview of what the breakout session will look like, you will develop your caregiver respite action plan along with your facilitator. You'll identify some of your personal strengths because I think that's really important to remind yourself of as part of your caregiver journey. You wouldn't be doing this if you didn't have a lot of strength of character to begin with. There's still a listing of those barriers to seeking respite on your action plan. We'll ask you to consider ways in which respite would benefit you and your loved one. There's a little menu for additional caregiving needs and an opportunity to establish a respite goal that's personalized to yourself. And more importantly, this breakout session is an opportunity for you to meet and interact with other people and get support. Next slide. After the breakout session, we're going to join back here to discuss some themes that arose during the breakout sessions. Your facilitators will kind of harvest everything together and share that with the group. But of course, if we miss anything, you're welcome to share that as well. And then we ask that you please, if you have the time, join us again at 2 p.m. for our panel discussion and to hear opportunities on how to start your respite journey.
So Teresa and everyone here, we might have a little bit of a change in format. I just found out that webinars don't allow breakout rooms, which I apologize for not researching that earlier. We spend a lot of times on meetings and have that option. So we're going to just do we're going to call it one great big breakout room. And I know there was one question in here that Cynthia asked that I have a feeling is going to be relevant to a lot of people. She said one thing she's heard from others is that the caregiver wants to take some respite, but the partner does not want them to take respite. An example, they're not comfortable with a stranger in the house. They don't want to spend the money, etc. What do we do then? And I can say from personal experience, it happened when we were caregiving for my dad. He didn't want anybody else there, but you really need a break. So what do you think?
Sure, I definitely think that's a challenge. I do think that the only way people get more comfortable with other folks coming in is to get started. It sounds very simplistic, but things really do only get easier if you start to do them. So I think having some kind of introducing someone can be a nice first step into that. The other piece is, I know that it can feel expensive, but it really is an investment. So it really is kind of saying, you want me to be here to take care of you. I'm exhausted. This is an investment in me being able to take care of you longer over the longer term if I get a little bit of a break now. It's kind of like filling up your gas tank.
Thank you. I'm going to share the caregiver respite plan. And so we'll go over this. And everybody, I apologize for the change in format here. We were looking forward to these breakout rooms, and I have a lot of colleagues who spent a lot of time getting ready for them. And I apologize to all the facilitators. This was not supposed to be how do we deal with unexpected events, but here we go. Sometimes that's what it is. So I'm
just gonna roll with it.
Roll with it. Yeah, if there has ever been a year for unexpected events, I'd say we finished it, and we're honestly still in it. We'd also like to think we're done with all of that business, but actually I'm gonna very quickly, before we go into the breakout room, I'm gonna invite Dr. Karen Moss to share a little bit. She's gonna talk about a couple of research studies that people have the opportunity to participate in. Karen, are you able to unmute?
I believe so. Are you able to hear me okay?
Yes, thank you.
Wonderful, wonderful. I'm just going to share my screen real quick. Good morning, everyone. Thank you all for being here. I listened in to the first presentation and found it to be phenomenal information. Are you able to see the screen with my flyer? All right, so I want to thank the sponsors and hosts for putting together this webinar. I am Karen Moss. I am an assistant professor at The Ohio State University in our College of Nursing, and wanted to share just really quickly 2 research opportunities that we have currently going. One is specifically focused on family caregivers who are African American and caring for a loved one with dementia or have been in the past. So current or former caregivers. We're looking to do about a 1-hour interview with these individuals who about healthcare decision making, specifically around end of life planning or advanced care planning. So if you're a current caregiver, if you can share with us, what it's been like for you this far, and if you're a former caregiver, you can share retrospectively what it has been like for you when you were caring for your loved one living with dementia. A $50 Walmart gift card is what we will give at the end of the interview. It will be done. I know here it says group interview. That was the original plan, but we are doing them all by telephone now, so in the convenience of your home. So you can reach out to myself, who's the direct contact for this particular study, to find out if you would qualify. And I know for both flyers that studies that I'll mention, Missy is sending them out by email, so you'll have that in your packet of resources. The other cool thing about this particular study that I want to mention just briefly is that in addition to speaking with current and former caregivers who are African American, we are also reaching out to healthcare providers and community stakeholders who do not have to be African American. So if you think you fit any of those qualifications, our healthcare providers, of course, are nurses, physicians, community health workers, social workers, and the like. Community stakeholders would be church leaders, heads of Alzheimer's associations, any other civic organization that interacts with either the person with dementia or the caregiver, because we're trying to get their perspective as well on what it's like, what the needs are for this group of individuals preparing for the end of life. So that's one study. The next one, or group of opportunities that I'd like to share with you is we are interested as a part of this research team that I am a part of, even though Mr. Iverson down here is the person that you would contact. This is a group of 3 studies that we're actually conducting with pain in older adults with and without Alzheimer's disease. And for this opportunity, we are doing a lot of the the 3 studies are remote. So what we would prefer to do is that you reach out to us and we will let you know which particular study you qualify for. This study, like I said, we're looking for folks with Alzheimer's disease and without Alzheimer's disease as well. And we're trying to see how we can do a better job of managing pain within this population. And so if you reach out to Mr. Iverson for any details on this particular study, we'll be happy to let you know which one of the 3 studies you would qualify for. And that's it. So I thank you so much for your time and attention, and look forward to listening into the rest of the conversation. I'll stop sharing now.
And
Laura.
Dr. Moss, there's a question in the chat box.
Oh.
Who wants to know, is this open for those not affiliated with OSU?
Yes, actually, these are community-based studies. You don't have to be affiliated with OSU because they have different criteria. But so that's why we're asking folks to just reach out directly to us with your specific questions, and then we can let you know which studies you qualify for. That's a great question. I am not able to see the chat from where I am. Why am I not?
There are no more questions in the chat, but if anything comes up, we'll let you know.
Okay, thank you so much. I really appreciate
Actually,
your
one
time.
did come up.
Okay.
Somebody said this morning, Dad said he hurt all over, but when I attempted to give him Motrin with his breakfast, he said he was okay. Can my dad participate in the study?
Yeah, so particularly for the ones with pain, we are looking for folks who are communicative. So that's one thing. So it sounds from what you shared so far, but when you speak directly to us, we'll go through the finer details and let you know which ones he would be able to qualify for. Great
And
question.
then will the contact information be sent or via chat?
Yeah, so the contact information is on the flyers, and Laura is emailing them out with the packets. So you'll have copies of both flyers.
I'm gonna, excuse me, I'll email the resources. I have a couple pages of resources that I'll send out later this afternoon, and both of those flyers will be on there. I think that based on the permissions they got from OSU to hold these studies, I'm not allowed to post the flyers online, but I will email those to you.
That is correct.
Yes.
Thank you.
We have to be careful with what we do. And then if anybody did not get seriously, I'm also going to send out the caregiver respite plan once the workshop's over. I'm going to send that out. That'll be one of the resources that get emailed out. I'm going to share it on my screen right now.
I'm going to stop share.
Okay, thanks. Thank you. I'm going to share
you.
the caregiver respite plan over here, and we can go over this. Can you all see that on? Can you see it? Yeah, good.
That's good.
Okay. So here is the caregiver respite plan. If you need to if you need it any bigger, I can do that. And I emailed it to everybody with the sign-in instructions, but I'll send it again, like I said, after this webinar. So Teresa, do you want to just walk us through this and then?
Yeah, that sounds good. Well, so a lot of the information about what is respite were on the slides there, but it is always helpful as a refresher. So it's just a break between the caregiver and the care recipient, either formal or informal. And the amount of time really depends on individual needs. And then sometimes it comes from us, and sometimes it comes from family members or providers that plea to please get some respite help. So if you want to scroll down a little bit, Laura, we'll look at some personal strengths. And so folks, if you want to fill in the chat box, I have some examples of personal strengths here. So one is resilience. I can land on my feet. Patience. I can accept delay without getting upset. Flexibility. I am ready and able to change course in the moment. Confidence. I am sure of my abilities. Optimism. I expect a favorable outcome. Humor, I can see and appreciate what's funny in a given situation. compassion. I want to alleviate suffering. So if any of those personal strengths resonate with you, I'd love for you to go ahead and share that with us in the chat box. Or if you feel like you have other personal strengths that have helped you so far on your caregiver journey, please feel free to type those into the chat box. I remember one time when I worked in physical medicine and rehab, someone said they try to think of their time there as a Mel Brooks movie, and that really helped them feel more adjusted to having a bunch of people care for them. So let's see, someone has chosen tenacity. Oh, I like that. Like, let's see what the day has in store. I agree. I think humor really does go a long way. The situation itself can be really dire and difficult, but being able to find some little pockets to laugh can build a lot of resilience, right? And it sounds like Sandra's got a lot of personal strength she's bringing to the table here. Ooh, and I like resourceful too, because that definitely means you're able to really tug at your social capital and be able to find people and agencies to help you. That's wonderful. Good deal. Well, I want you to just sit with that for a second, those personal strengths that you all have identified, because those really are your kind of little weapons, if you want to think of them as weapons or boons, you know, things that you are taking with you as part of your caregiver journey. And I think that's important to remind yourself of as you seek out respite care, to say, hey, I'm a resourceful person, or I'm compassionate. And, you know, the reason that I'm doing this is because I have all of these skills and I can find what I need using these skills. And let's see here, I want to make sure that I'm monitoring the chat here too. Yes. You kind of learn from your experience too, and that in and of itself is a strength, I think. And mindfulness, wonderful. Well, thank you all. Laura, if you want to continue scrolling down, we'll continue on with the respite plan here. So these were listed on some of the slides earlier, but I'd love to hear from you all. What do you think are some of your kind of psychological barriers to seeking respite? So we had intense feelings of guilt, discomfort with asking for help, feeling overwhelmed, poorly defined goals, comparisons with others, and then there were two more that I can't remember which order I had them in. Laura, if you want to scroll down a little bit. Yes, the fabulous tendency to overcommit and goals dependent on another person. Do any of these resonate with you all, or are there some additional barriers that you've run into? I love that one, Patrice. I'm glad you brought that up because it does. I think for a lot of folks, it's taking that time on the front end to get something set up does feel like a lot of work. Absolutely. For those of you, and I think that's something I would definitely encourage you to bring up during the panel this afternoon, because I think that would be an excellent discussion piece. But I will say again, I think of it as an investment, right? So you do put in a lot of resources on the front end. But once you get that opportunity, and hopefully you're able to focus on the satisfaction you get from the break, that it does end up feeling worth it in the long run.
Teresa, we have Karen that said she's alone in her caregiving. She has no siblings, kids, or spouse, and it's really overwhelming. What are your suggestions on that for her?
Yes, so that really might be a time to bring in some type of agency. There are kind of the area agency on aging, depending on who you're caregiving for. I don't know if it's an older adult or the person is maybe someone with a developmental disability, but if you don't have any friends who could also assist you, then it might be mean applying for help through a specific agency. And there are certain nonprofits who help with that. It might mean doing some paperwork on the front end to get additional benefits, but in the long run, I think that's very worth it.
So it sounds like quite a few people have maybe other relatives that don't understand the impact of it or the level of need. Family that doesn't want strangers in the house. I think some of these have kind of come up, but still.
Yes, yes.
Yeah.
And I would say encourage those people to think about how it can go well. A lot of times we spend a lot of airtime with our anxiety thinking about all the ways that it could go wrong. And so giving some additional airtime to talking about how things could be beneficial. You know, what if you get a chance to talk to somebody who's not just me? You know, you probably get tired of talking to me. It might be nice to see somebody new. So trying to find some different ways that things can go in a positive direction. Now, when it comes to sibling involvement, especially if someone's not aware of the loved one's needs, there's a famous saying that goes, I can explain it to you, but I can't understand it for you. And so you can always say that to that person and say, this is the direction we're headed unless you're going to step up and be here for that person. And it's okay if we don't agree on everything, but I need respite and that's what's going to happen. And that involves, again, kind of you having the confidence to do that. Yeah, so a lot of times the loved one has a lack of insight. I'm reading through the chat box here and it looks like someone has said, what happens when your loved one doesn't think they need assistance, although it's you giving the assistance? How do you make the decision to move them in? Well, again, that's kind of the I can explain it, but can't understand it for you type of situation. Obviously, because of their caregiving needs, they aren't necessarily aware. You can't abandon them and show them how much assistance they need because that would be neglectful. But you can also kind of step in and seek informal permission to take over some of that decision making, either at a doctor's office or unfortunately, and some people have to go this route, they have to seek legal advice. So I would also recommend if there's tons and tons of pushback, getting involved with an attorney who specializes in elder law to help them. But again, that's another kind of goal that's dependent on another person changing. As much as we want to balance respect for our loved one's autonomy, we also have to recognize that they probably aren't going to come around and just magically change their mind.
Karima made a really good point that she'd have to explain to her dad, this help is for me, not just for you, and that could help her change the perception.
Yes, absolutely. Excellent point.
That's, yeah.
Yeah.
And then somebody else said, I can explain it to you, but I cannot understand it for you. Boy, that addresses more than just a respite thing, but we'll keep it to that. But yeah.
Oh yes, I've seen it on t-shirts.
All sorts of borders of what that works with. Thank you.
Yeah. Let's see. I think there were some additional ones here. Once I tried to take a little break, responded by almost petulant. Just go to, yeah. So there's sort of a guilt trip that comes along with that. And I think that becomes sort of they're probably not going to stop putting the guilt on you. And so it's up to you to kind of take that step for yourself and to say, okay, you know, I do feel guilty about it, but I'm going to do it anyway. Because if you think about it from a behavioral perspective, you're sort of rewarding them for laying the guilt on you. So now they know where to start next time if you try to assert boundaries.
And Teresa, do you feel like part of that is, like with my father, he's been gone for 2 years, but he was so independent and outgoing, and suddenly having that change for him, it was really hard. It was hard for us to take away the independence, but it was also hard it got frustrating to where we know what's best for you, but it's as a child, it was very hard to tell your parent who taught you to drive, you don't get to drive anymore because so many reasons, but it's it's hard to get back into that mindset of, I know I'm taking away your independence, but yeah.
Yeah, and you're really speaking to that role reversal that happens too as part of caregiving for parents. Someone had said it took your brother seeing a bad episode before becoming able to believe how bad it really was. And then, you know, I had a similar situation with my grandfather, who he got in very luckily a very small car accident with no injuries for him to realize that it's just unsafe for him to be behind the wheel. And I think sometimes explaining that to the person and saying, I don't want you to get hurt, and I don't want you to have to live with harming someone else, as frustrating as it is to give up that independence. Yeah. Excellent responses here. I don't know if Karima or Laura, if you want to read some of these, but someone had said that happened with my father. He would always defer to, Tom can do that when he's here. And that list got really long. And once my mother and his doctor pointed out the pressure that put on me, it opened up a conversation on how to engage others. Absolutely. And who sends the message is a reliable tool too. So we kind of have to let our egos go, because we might have said it 30 times, but then finally someone else says it and it clicks for the person. So we have to be focused on the end goal more so than getting the credit for coming up with the idea.
Yeah, and Melissa kind of made a point about boundaries, saying, you know, it's hard to have them when you care so much. She says, understanding that the care recipient doesn't get to take respite from their condition, but we need respite to bring kindness and support to them. So interesting perspective there.
That's true. I think that's a great perspective. You know, if we're all suffering as intensely as that person, then we're not all in the position to be able to help one another. And thank you for sharing those resources. All right, I know we have a few minutes left, so I want to make sure we get through the caregiver goal sheet here. And so this is really for you to fill out here. But Laura, if you want to scroll up a little bit, I really encourage you to think about what you could do if you had extra time to relax. You know, get into a little fantasy here and think about what you might be doing if you had a little bit more time for yourself and how nice that might be. I have been indulging in a fantasy of laying on a beach during the entire pandemic, and that really keeps me going. So really think about what you might do with that extra time. There's also a menu there of other things that someone might need as part of their respite plan. I have often heard from caregivers that they don't really know where to start. They're like, I say, what is it you think you need right now? And they say, I don't even know what to need. And so I've got a list of common needs on there. And that can really help you begin to enlist your support network. You know, maybe you have someone who's not the best company, but they're an excellent cook. So maybe they could help you out with meal prep, things like that. Or maybe you have someone who's not a great cook, but they can drive someone to appointments. And then if we want to go down to the last few pages here. So we've got a reminder of the SMART respite plan. And then there's steps for you to fill out for your own respite goal. And I have some examples of what someone might put for each of those steps. And then I encourage you to think about how you might feel if you were to actually go through with this. So there's some little check boxes at the very bottom that kind of articulate how you might feel emotionally if you were to seek that support. And I agree with you, Jean, it does help to have the doctor say it. My husband and I are both psychologists. He's a neuropsychologist, and we both have those conversations. And sometimes it's nice to have it come from someone who isn't seeing them and living with them regularly. So that way, you know, we can take the hit. We're okay with that. If it means that it's helping a family member out to help the loved one understand what needs to happen. And I would agree with not trying to make decisions during a crisis, because your choices are more limited when you've reached a crisis situation. Let me see if there's anything else that I haven't shared here. Parent who decided to not purchase another car. Yeah, very good. Well, we've got, I think, a couple, maybe like 1 or 2 minutes left. Does anybody have any additional questions, any reactions, responses? I really appreciate what everyone has shared today. It sounds like we have so much to address as part of our caregiver journey, and I'm really happy you took the time for yourself today to be able to come to this talk.
I did want to ask Tom Hess. He's with Ohio Department of Developmental Disabilities. There's a, I don't know what we call it. There's a resource called Loop Ohio, because we have had a lot of amazing conversations going on chat. And I know sometimes it helps, even if you don't solve a question, it helps to hear that somebody else is in the same situation. So Tom, could you give a little overview on Loop Ohio? And this is the way to get into Loop is what is part of the resources I'll be sending out later today.
Great. Thanks, Laura. Yeah, I'd be happy to. We've had some really great success with www.loopohio.org. That's the website link. We've set that up as a community of practice website specifically for the state of Ohio. The idea is that people, and it's mainly around people with disabilities and working in the rehabilitation field, but the conversations kind of took off into other areas to include respite and aging and transportation and resources, really, as people took over the conversations. So it's a great tool. It's free to people who live in Ohio. You simply go on and register. And what I like about it is it can be anonymous. So you can go on and just sign up and lurk and watch conversations and see the information that's being shared. Or you can get involved in groups and be more active and more engaged, which I think suits a lot of people's needs. The other nice thing about Loop Ohio is the conversations are all mentored. So we have a professional who mentors those conversations to make sure that the advice and the information and what's going on in that arena is valid and safe. So I think it's a really great way to get engaged in conversations across the board, and specifically around respite. We're going to be starting a group with the Caregiver Support Network right after this event, which is really fantastic.
Can you give just a quick overview of the process? I know I had to register and I had to tell you, and then you invited me. Is that?
Yeah, I think the best way to do it, and I'm giving you work to do. So the best way to do it would
you a
be
lot of work.
to have people sign up and then email you
Okay.
and say, I'm signed up, please add me to the group. And that's a wonderful way to do that. And that way there's one point of contact.
Thank you for joining us today for Respite, presented by the Ohio Caregiver Support Network. I'd like to thank again our presenter, Dr. Teresa Young, for a wonderful presentation. I hope you enjoyed it and you got some great information out of it. Handouts and resources for this webinar are available at agrability.osu.edu. That's spelled agrability.osu.edu/caregiver-support-network. Thanks a lot.